In 2007, the Mayo Clinic Bioethics Research Program convened an advisory panel of local residents. Chosen for diversity to represent the community, they met over 2 weekends to consider the issues surrounding the new biobank. Participants, none of whom were experts on biobanking or genetic research, were first briefed about Mayo Clinic's plans for biobanks. They learned why science needs biobanks. They also discussed concerns a biobank donor may have. Issues like oversight, informed consent, privacy, confidentiality, and who owns the genetic samples. The participants had frank discussions about religious and cultural views about genetic research and past medical research and public health abuses. Usually, it is hard for individuals to have an impact on how science is practiced. Scientists and researchers rarely hear about the concerns of regular people. Here, ordinary citizens were empowered to engage in a series of discussions to inform research agendas. The aim was to bring to light issues, values, and conflicts, and make design recommendations for the biobank. The sessions used a deliberative democracy meeting framework. These processes were developed by political scientists to help foster discussions between various stakeholders with different points of view. They have been used since the 1980s. They are a political discussion tool used in a democracy to help develop legitimate public policy that is accountable to the people it governs. And they allow participants to understand and negotiate policy trade-offs. Recently, they are being applied to significant public health issues like pandemic flu planning and biobanking.
This is not a typical way of engaging with a community. More often, a group, say a governmental group or a hospital or a medical institution might, if they want to talk to a community about something, they might start with an educational campaign or do a survey, just seeing what people's views are. We wanted to really get much more in depth and find a way of allowing the members of our community to have a direct voice in how we set up the Mayo Biobank.
In Mayo Clinic Deliberative Democracy sessions, experts made educational presentations but were not part of the deliberations. Consensus on issues was not forced. In fact, diverse, sometimes conflicting opinions were solicited and encouraged through dignified, respectful discussions about both the benefits and drawbacks of biobanks.
I thought it was handled really well. I thought the moderators did a great job from day one of setting up the tone that this was going to be a dialogue, not a monologue, and that people were going to have differing opinions, and the important thing was to listen to their perspectives.
After agreeing about the value to society that the creation of biobanks would provide, participants were asked to negotiate necessary trade-offs as they developed a set of key recommendations.
That was really hard to decide when you had so many different things in front of you, and you realized you're having to make a lot of choices and placing, I guess this is pretty important, but not quite as important as this. So you had to really think through a lot of morality issues and place values on those.
Continuing concerns and irreconcilable conflicts were carefully noted for future deliberation, because it's important to know where disagreement exists. Using the deliberative democracy ground rules, small group discussions were then presented, compared, and validated in the larger group. This collection of strangers soon became a confident citizen advisory panel with valuable insights.
I really support this, and I'm excited that I get to continue to be on this.
I see myself definitely as an advocate for this. I think it's really important, but also as a watchdog, because I want to make sure that there's a lot of questions about this and a lot of issues people might have with the whole biobank and giving their blood for this and to be used years and years and years to come. And I want to make sure that those are respected.
And I have to say, as the principal investigator for our biobank, the community advisory group, hands down, has been the most useful to us in really being that voice of the community and what are their concerns and how can we address them.
After the 2-weekend event, participants endorsed Mayo Clinic's plans to create a biobank. But more importantly, they provided a set of key recommendations for its design and implementation. They recommended development of a simple informed consent process, an option for participants to withdraw from the biobank, allowing sharing of DNA samples with researchers outside Mayo Clinic if standards are maintained, and ongoing community involvement and oversight, including a biobank community newsletter and website. These recommendations are being implemented by the Mayo Clinic Biobank. This includes forming a community advisory board to continue to dynamically articulate concerns and contribute ideas.